Welcome to this program on the care of Lennox-Gastaut patients. And this is a presentation on epilepsy and the challenges of managing seizures associated with the Lennox-Gastaut syndrome. I am Raman Sankar from UCLA Mattel Children's Hospital. And this particular program is sponsored by Aquestive, and it is not a professional medical advice, diagnosis, or treatment. And it is sponsored by them, and I am speaking on behalf of Aquestive here. Okay, and what I'll cover today is an overview of epilepsy, challenges in treating seizures, what the Lennox-Gastaut syndrome is, and the challenge with medications that we use and administering them in particular, and treatment of the seizures, and the innovative way for medication delivery. Okay, so the overview of epilepsy. What is epilepsy? It's a combination, it's a condition where seizures occur without any undue provocation. So we don't call isolated seizures from, let's say, dehydration or an electrolyte disturbance to be epilepsy. But in epilepsy, seizures occur without any provocation. There are 3.5 million people in the United States who have epilepsy. And what causes is often unknown, although we are finding more and more causes now with the advances in molecular genetics. But it can be a genetic disorder, or it can be a response to an injury, an infection, acute, or an infection that causes damage, and then loss of oxygen to the brain that we call hypoxia, ischemia, and all these problems. How is it diagnosed? We use the history as a number one aspect of the diagnosis, and then it is supported by EEG. An EEG is an electroencephalogram. It records the electrical activity in the brain using small electrodes attached to the scalp. And it gives us the pattern of brain activity and changes there may be. So they can show spikes or sharp waves. These are all on a background from which these stand out. Some of these can be generalized, or some of them may be very focal, indicating disturbance in discrete areas. What they show, these spikes and sharp waves, is I often use the term, these indicate areas of irritability that can be widespread or very localized, and they show a potential. Okay, and an overview of seizures. Again, they can bring a change in awareness, emotions, senses, movement, thoughts, behavior. So the manifestation of a seizure depends a lot on where it is coming from, including if it's coming from all over the brain, there's going to be loss of consciousness. Usually any kind of motor movement requires, in this part where I'm showing with this is the motor strip or the motor cortex. Area behind it is sensory for somatosensory. This is the visual cortex back here. There could be language disturbance if it's over here or over here, and so on. It really depends on what part of the brain is involved. And as I showed you in the previous slide, pointing to the anatomy, focal seizures can occur when they come from those discrete areas. Generalized ones can involve absences, atonic seizures, myoclonic seizures, tonic-clonic seizures, all these varieties. Interestingly, as you will see, in the Lennox-Gastaut syndrome, just about all these types of seizures can occur. Okay, the stages of a seizure may involve an aura, but it's not always the case. Again, it depends. What happens is if you have a very, very discrete focal onset, you could have an aura which corresponds to that. And then the ictal is when the seizure spreads further. And during the ictus, you may or may not have consciousness, and therefore the aura would end and a big seizure would start. And then the post-ictal is the recovery period that can take varying durations. Again, depending on the extent of brain involvement, you may think of the postictal period as one where the brain involved in seizure is you could think of it as exhausted and needs a period of recovery. Okay. So the caregiver's role is to document carefully what they see so that the physician can find it as a useful information. Okay. And it's probably good to write it down so you can remember. One of the important things is when you're witnessing a seizure, it's everything seems to be happening so fast. And then later when you try to recall, it seems like a very long time. And there's a considerable distortion unless you take good notes in your recollection. Okay. And the tracking seizures, there are also online tools, especially to keep a seizure calendar in which you can enter data like missed medications or change in medications for that matter. Challenges in treating seizures. We use the term refractory seizures to refer to seizures that are very difficult to treat or those are treatment resistant. Okay. And you need to be ready with a seizure response plan that can be like a rescue plan. And to get started, you should talk to your doctor, neurologist, usually neurologist or epileptologist, although in some situations it could be your primary care doctor. Okay. Missing treatment is one of the big causes for why people end up having a seizure, even though they have a regimen. So a questionnaire showed that more than 2/3, 71% of patients reported that they forgot, missed, or skipped a dose at some point. Nearly half reported that they had a seizure after not taking a dose. And a third of them told doctors when they missed the dose. Okay, so just giving the medicine is a challenge because not everybody is able to swallow a pill. As you know, the majority of medications come as a pill, and almost 46% of caregivers have to crush the pill, mix it with the food. It's really work. It's not as straightforward. And then sometimes they don't finish all the mixed material. So there is inadequate dosing. Okay. And 70% of the children sometimes refuse to take the medication. They spit out the medication, not uncommonly. We know some medications that come in a liquid form with sweetening and flavor added, but often they don't entirely mask the taste. They still end up tasting something unpalatable. Okay, so nearly 3 out of 4 caregivers have this concern that their medicine is not being given in full dose. The other problem is every time the patient refuses to take or spit it out, you have to do it again. You tend to run out of the medication before the end of the month, and you have to have this hassle with the pharmacy. Go there and they tell you you've already been given all the medicine you get for the month. So it's a real problem I hear all the time. Now I'm going to talk a little bit about the Lennox-Gastaut syndrome. It's a rare, although in a practice such as mine, it's not particularly rare. Every day I go to clinic, I usually have a couple of patients at least with this. And it's a severe kind of epilepsy that starts in childhood, and it affects about 35 to 70,000 people in the United States. The exact number is given as a range because not everybody is very competent in actually diagnosing it accurately and recognizing it. Okay. But the cardinal signs are multiple types of seizures that respond poorly to medication, developmental delays or intellectual disability, and then there is a EEG fingerprint that those of us who are experts in looking at the EEG can identify very quickly when we see that pattern. Okay. And life with the LGS, I will use that term instead of Lennox-Gastaut, they have lifelong issues because of the developmental problem. They're both cognitive and often motor disabilities. They rely heavily on parents, siblings, and other caregivers. Physicians can prescribe a variety of medications now to treat LGS. No single medication controls them completely. I do not know any LGS patient who is only on one medication. Most of them are on multiple medications. And there are other treatment options. Some of them may supplement medical treatment with the ketogenic diet, which is a high-fat, low-carbohydrate diet that has been around since the 20s, but much more popular since the 90s. And studies show that up to 50% improvement can be achieved with a ketogenic diet. There are occasional patients who, when properly implemented in combination with medications, may achieve near seizure freedom. There are also electrical treatments like the vagus nerve stimulation. This is a neurostimulation approach. It's a device that's implanted in the shoulder, as you can see, and a small cable takes discharges to the vagus nerve. The vagus nerve then takes the message to projections all over the brain, and it is done through neurotransmitters. And VNS can often reduce seizures by up to 40-45%. It seems to be very useful in Lennox-Gastaut with the drop seizures, or seizures where the patient may either stiffen up or lose all their tone and fall to the ground. Challenges with medication administration is a big issue in LGS. One of the common problems is swallowing difficulty, interference from frequent seizures, and cognitive and behavioral challenges. They may be oppositional. All of this may make sometimes every day that period of administering the medication to be a struggle. Anything that makes it easy is helpful. So for many, it is crushing, mixing, careful measuring, etc. So some of the approved medications are listed here. That includes cannabidiol, clobazam, clonazepam, felbamate, lamotrigine, rufinamide, and topiramate. And there are some now in the investigational pipeline as well. I should give you a perspective by saying 30 years ago, when I started treating Lennox-Gastaut patients, I did not have access to any one of these medications. So you can imagine where we have been and where we are now. So just like we have advances in medication, part of my goal in today, talking about this in this program, is an advance in actual mode of administration of a medication, as you will see. So talking about clobazam, it was actually introduced in 1974, but did not come to the United States until 2011. It came after there was considerable request from families and from physicians treating them that we would benefit by having this medication. Then it was given an orphan drug status to speed its approval, and studies were undertaken then by a company called Lundbeck that brought it to our market. Sympazan, the product I'm talking about today, is a product by Aquestive Pharmaceuticals, and it is actually that clobazam, which is one of the most effective medications ever for Lennox-Gastaut, put in an oral film. So it's a novel method of administration. And here you see the little package on the picture that the person is holding that gives you that size of the package. It's pretty small. You can compare it to the thumbnail. And this is the package that you tear to release the film. And it's a prescription medicine that is approved for Lennox-Gastaut. and that is, it is really clobazam that was approved. Sympazan is the new way of giving clobazam. Okay. There are important safety information. It's particularly important for your doctor to know, but for the caregiver, the important thing to know is it's a benzodiazepine medication, meaning it's related to what everybody relates to as Valium, that class, can cause drowsiness. Too much can cause respiratory problems, coma, or death, particularly if combined with opioid medications. Fortunately, in my clinic, this is not a condition I often encounter because hardly any of my patients ever are on opioid medications. But it is part of the FDA warning. It can, again, it's kind of interesting. We read this because it's a FDA requirement, but really, I don't know of any LGS patients who will drive or operate heavy machinery because they generally do not have the motor coordination or, most importantly, cognitive and judgment skills. So that's really not part of LGS. It's part of warning about that medication. Okay. And they generally don't drink alcohol, right? And abrupt stopping of clobazam, even in the form of sympazam, can cause withdrawal seizures or status. So that again is an important warning for your healthcare provider. Okay. What you need to see is it's clobazam in a different formulation, and it's designed for people who need a different form because they spit, drool, or have difficulty swallowing. Caregiver has challenges in preparing it for administration, and they also, all these are not very portable. Remember, you don't travel, you don't go to even another doctor's office or to a therapy place carrying a pestle and mortar and all those things. So one of the great important is the portability. Okay. In a clinical study, the active ingredient reduced weekly seizures dropped from 40 to 68%. This is data obtained by Lundbeck and presented to the FDA when they developed clobazam under their brand name. Okay, so clobazam, then how does sympazam type of clobazam work? So it is a thin film, it's berry flavored, it sticks to the tongue and dissolves. You do not need any water. Basically, it dissolves and is swallowed by instinct, and it's therefore is absorbed by the digestive system. And the maximum concentration may be achieved in fairly quickly, like as early as 20 minutes in one study, after fasting, maybe a little slower on after a full meal. But the important thing is the absorption takes place here in the gastrointestinal tract. It's not a one that is absorbed in the mucous membrane of the mouth, but it is easy to take because it's just a thin film that is sticky and you don't need any water to chase it. So it comes in three sizes, as you can see, 5, 10, and 20 milligrams. To give you a rough idea, you can see these are all, one dimension is 22 millimeters. I want to, for those of you who are not used to this mode of measurement, 25 millimeters is 1 inch. So right here, this is approximately 1 inch. And over here, this may be about 1.4 inches. Okay. And that is the largest dose, the 20 milligram dose. The 5, on the other hand, you can see is roughly a little less than 1 inch by ½ inch. Okay. And a few words on the ketogenic diet, since it is commonly used in LGS. Most of these limit the amount of carbohydrates you can take to 8 to 10 grams, and they are carefully computed by the dietitian, the doctor who would help you with the program. When beginning it, many patients on oral suspensions are switched to tablets to minimize the amount of sweetening. So the key thing for a Lennox-Gastaut patient, if they are on the ketogenic diet, it's particularly challenging because they cannot use many of the liquid meds. So the good news for patients on sympazan is the amount of carbohydrates is really, really small. So compared to the oral suspension, If you look at the 5 milligram, which is a pretty small dose, 0.38 or about 4/10 of a gram, and that is what's in the oral suspension. What's in the Sympazan oral film is 6,000th of a gram. Basically, you can call it close enough to be, for your practical purposes, 0. 10 milligram, it's about 3/4 of a gram in the oral suspension, 10th of a gram in the tablet. Over here, remember I told you 0.066 is practically nothing. So twice nothing is still pretty close to nothing. On the 20 milligram tablet, we have 2/10 of a gram. Or if you're using the liquid suspension for 20 milligrams, you're going to end up with 1.5 grams. That is per dose. So if you're taking it twice a day, that'll be 3 grams. Sometimes that is way too much carb for people on the diet. However, if you're on the oral film, that is really about 0.025. Remember, 0.25 would be 1/4 of a gram. This is 1/40th of a gram. So about 98% reduction compared to the oral suspension. Okay. This is, I won't go into the keto diet calculator and all that in this interest of a limited time I have, and instead focus on the fact that Sympazan is supplied with 1 month supply in a box, and it is dry, easy to carry. You get this consistent medication dosing with this. There is no substitute. So one of the things my patients also remark on is, now that clobazam is generic, they don't always get reproducibly the same preparation every time. With Sympazan, there is only one oral film, and that is Sympazan. So if you're placed on it, you will always get that consistent product. There's no product variability month to month when you get a new supply. Okay, and during this COVID crisis, the company is offering 0 copay. And it says in the slide, through September 30, 2020, but I have heard that it's been extended. So if you go to acquire some now, it's still 0 copay, okay? And it cannot be substituted with the generic because there is no other preparation like this. The safety information, again, is in great detail. It's much more for your physician. The important things are that benzodiazepines in general can cause abuse or dependence. Skin reactions have been seen, but extremely rare. This warning on skin reactions is unique to our FDA. Most other countries do not have that, so it's pretty rare, but it should be recognized that it could. And all seizure medications have been asked to warn people about suicidal thoughts, etc. That again really does not apply to LGS. LGS people are significantly cognitively impaired. They generally do not have suicidal thoughts, nor can they usually have the capability to proceed in planning. Okay, and other safety information, talk about your healthcare condition. And these are all, again, your doctor should already be worried about these. And the birth control medicine may become less effective. Again, most of my Lennox-Gastaut patients, this is not really a concern. Generally, LGS patients are not childbearing, so the pregnancy breastfeeding, again, is a theoretical concern. Okay, but if you go on Sympazan, definitely, I would think that your prescribing physician would ask you what other medicines you are on. The side effect, like I say, the significant one for anybody, the most important things are sleepiness, slurred speech, drooling. These are the most common ones, especially on the high dosing end. Generally, it's possible to treat patients without all that. And in some patients, benzodiazepines can cause aggressive or angry irritability type of reactions, but they're not common. So here we have the major side effects. of these really sleepiness, drooling, occasionally acting aggressive, or which is related to being angry or violent. These are the more common things. Again, it's going to be a function of what other medication it's being used with and how it is dosed and so on. So when you talk to your physician, this is the key thing. Not every physician is quick to prescribe it. The important thing I have to say to you as a caregiver is you should be able to request this when you talk to the patient, especially the physician may have already decided that clobazam is a good choice for your ward. But you can say, may I have clobazam in this form, as Sympazan, okay? And there is also a website where you can register for more information, and you can also get a sample film to try. I have tried it, and the sample film is quite delicious.